Me too. I don't think we're going to.
Got some likes.
Okay.
You're not on it,
Good afternoon. I think we're live. Hopefully we're not just talking to ourselves here. We don't really know what we're doing, but the computer says we're live, so we're going to get started. Thank you for joining us for this, I think it's our second town hall, COVID-19 town hall on Facebook. We're glad for anyone that joins in and listens to what we have to say here, which honestly, we're just going to kind of wing it and try to give you a little bit of an update as to where we're at with COVID here at Fairview Haven. As many of you are aware, we do have an outbreak here at Fairview Haven. Thankfully, it's not a bad outbreak, and it seems as though we might be on top of it, but I'm not even going to say that yet because we don't know. But we did test all of our residents this week, and very thankful to report that all of our residents tested negative for the first round of testing. We do have to do 2 rounds of testing, so there will be another round coming next week. I believe on Wednesday we're going to test all the residents again, and we'll report what those results are. But please be prayerful that those could all be negative as well, so that we don't have to do anything further with our residents. As far as staff, just give you a little bit of history about our current outbreak situation. Again, many of you are aware of this, but on August 12th, Wednesday, August 12th, we had an employee that had to get tested for a purpose outside of Fairview Haven. And during that, she was deemed to be positive for COVID, and she notified us right away, and we implemented our testing plan right away. That Friday, we tested all of our employees. That's what our testing plan says. With 1 employee positive, we are not considered an outbreak. That testing round came back with all negative results. And then the next testing round, you have to do 3 testing rounds with all negatives in order to get out of the outbreak. The next testing round was on August 21st. We did that, and we had 1 positive. However, that did not count because that employee actually was not at work for a pretty long period of time prior to. So that one didn't count. And then August 28th, we did our what we were hoping would be our final round, and unfortunately we did have another employee that tested positive for COVID during that round. And that employee had worked, had been around some of our residents here at Fairview Haven, and because of that it was deemed an outbreak because there were 2 employees now that tested positive. And so we went ahead and implemented the outbreak policy, which means we test all employees and all team and all residents. We just finished our 4th round of employee testing today and sent those in, so hopefully by Monday we'll have all those results back. And again, if you're looking for something to pray for, you could pray that those could all be negative. We will continue to test every week until we have 2 rounds of all negative tests from both residents and team members. So we have been working with the Livingston County Health Department. They've been very helpful. Give them a shout out. They've given us lots of instructions and lots of advice as to how to proceed, and been a real good partner through all this, so we appreciate that. We do have plans. If a resident were to test positive, we have plans for a COVID unit. We have it all ready to go. We probably will discuss it just a little bit further every day to make sure that everything is implemented and ready. But we do have a policy and a protocol as to what we do if a resident tests positive. So what are we doing different because of the outbreak here at Fairview Haven? Really nothing has changed too much for our residents since August 12th when we found out we had an employee positive. Right away at that point, we actually canceled outdoor visits, suspended them. We have implemented those again. We felt like that was a little bit premature. So we have re-implemented outdoor visits, and those are still going. As long as we don't get any positive residents, we'll continue those, or as long as we don't have a staffing issue. We did suspend communal dining at that time, and we will continue to work with no communal dining and reduced group activities. We're asking our residents as much as possible to stay in their room, but we're certainly not restricting them from coming out at this point. They can still come out and socialize with other residents. We asked our staff to monitor very closely for 6-foot social distancing. And that's not only amongst the residents, but also with the staff. We've encouraged them to make sure they're practicing the 6-foot social distancing. We are also asking our staff to be very vigilant with mask wearing, and you can encourage your loved ones to also wear their masks when they come out of their rooms. Our residents have a hard time doing that, and we don't push that just real strongly because it is their home, and so we do try to respect that to an extent. We really come down on the staff and make sure they're practicing good mask wearing. But as far as the residents, we encourage it, and we tell the staff, do your part to try to get them to wear it and to wear it properly. And I think they are doing a little bit better since this last positive, so that's a good thing, and we'll continue to promote that. Some of the things that I'm just kind of looking through, we just had employee meetings as well, and I'm kind of using the same outline, but I don't want to bore you with some of the details that I bored them with. I think I'll just go staffing shortages. So at this point, Fairview Haven is not operating in any crisis mode or contingency mode for staffing. We're actually adequately staffed and have been for this entire crisis for the most part, not that we don't have some call-offs and so forth. We do currently have, just an interesting note, we have 10 team members currently that are off on quarantine because they were in close contact with other people that tested positive. So that definitely makes it difficult for staffing, but at this point we are not too terrible concerned unless we get a bunch more people that were coming into close contact or testing positive. We do have plans, we have policies for what happens if we have too many people out on quarantine. We have encouraged our staff to pick up extra shifts as much as possible, and I think that we will see that happen. Our staff really tends to come together in times of crisis and really help each other out, so I really do think that will happen. We also can move into, I'll just throw this out there too, we have asked our church congregations if anybody out there is a retired nurse or just a nurse not working right now, or a CNA, or even a previous CNA, you don't have to be current, or just have any skill that you would like to offer. If we get into bind and we need staff, I do have a list. It's not real long yet. And if anybody's listening to this or have a loved one that would perhaps be interested, let me know so that we can put you on that list. But if we get in a real bind, we do have people we can call up to say, not volunteer, you'd be paid, but it would be a temporary position until our staffing was back to speed. Also with that, that to me would be considered contingency mode staffing. CDC has come up with a couple different modes of staffing so that if we get into a bind, we can operate either under contingency or under crisis mode. Contingency mode, an example of that would be, so these people their team members that we have out right now on quarantine, they can actually come to work because they are essential workers if we get to a point where we need them bad enough. So that's an example of contingency staffing. An example of crisis staffing mode would be if we have residents that are positive and we open our COVID unit and we have several staff members that are also tested positive, those employees, those team members can come in and work in the COVID unit as long as they're asymptomatic. So there's different things that we can utilize if we get into a staffing crunch, and just know that we have that. I mean, obviously we can't predict the future, but we do have plans and we have thought through some different options if we get to that point. Did I cover everything on staffing?
Yes. Well,
Okay.
should we go over why we're suddenly trying to stay out of contingency mode?
Yeah, so Brandon just suggested that we talk about why we want to stay out of contingency mode, because that really doesn't present just a huge amount of risk to the residents if we enter the contingency mode staffing. But the reason we want to stay out of it is because with the reopening guidelines that the Illinois Department of Public Health has now given us, we can open our doors. Okay, let me just back up. So back in May, CMS came out with a reopening plan. I think I talked about this in our last Facebook town hall, but they gave us a plan, a 3-phase plan for reopening the nursing home. Unfortunately, it doesn't get it to the point where it was March 1st, but it does give opportunity for residents to go out on visits, and it gives opportunity for people to come indoors in phase 3. Still with some restrictions, still with some guidelines, but definitely a lot looser and a lot more opportunity for our residents. So that all happens in phase 3. We are currently in phase 2 of the IDPH reopening plan. And basically what phase 2 allowed us to do was have the outdoor visits. That took effect on August 14th. That's when the reopening plan actually was implemented. And you might be thinking, well, you were already doing outdoor visits, and that's true. We've been in phase 2 probably since June, I think. But now the plan is actually written, and they put you where you were. So we have to operate in phase 2 until we meet criteria to move to phase 3. And so I'll talk a little bit about that criteria. So the first thing is, do you have a testing plan, and do you have the capability to test? And at this point, we do have a testing plan, obviously. We've been implementing it, and we have capability to do so. We currently have a partnership with Gibson City Hospital Lab. They have been an awesome partner to work with, and that's been going really well. So we're thankful for that, and I feel like we will have the capability to test for as long as we need to. So I think our testing is covered, and that we can check off. We have to have a universal screening process for all people entering the building. And for those of you that have come for an outdoor visit, you know that we have this kiosk system at the front desk. You have to go through and answer a bunch of questions, basically asking you about symptoms and contacts that you maybe have had. And then you have to have your temperature taken by a third party, and that needs to be entered into the kiosk. So that's our universal screening process. It's going really well. We have somebody that monitors that, and 3 times a week she goes in and she compares as far as employees to the schedule and who actually work the time clock, and we compare that to who screened in on the kiosk, and we make sure that nobody's entering their own temperature. And so there's definitely things in place that we are monitoring, making sure that the screening process is working adequately. We are required to have sufficient PPE as well as sufficient cleaning supplies. At this point, we are not struggling with PPE or cleaning supplies. That could change, but right now we have a fairly good stock of PPE, and so we'll continue to monitor that. But at this point, we are doing okay on that, so that's checked off. You have to have adequate staffing, and what they mean by adequate staffing, this was what Brandon was talking about, is we cannot be operating in contingency or crisis staffing mode. We have to be operating under normal staffing levels. Normal staffing. I don't want to say normal staffing levels, because we staff at quite a bit higher level than what the state requires us to staff at. And as you are well aware, that's because we want to provide quality one-on-one personal care. And so we do staff quite a bit higher than what the state minimum requires. If we get into a situation where we can't staff at the levels that we're at, we may have to back down and have less staff here. If we do that, of course, you know, it's temporary, understand that, and we will work through it as fast as we can. I know too that if, you know, we get short on CNAs, our office staff will be out there to make beds and help in any way that they can. So I guarantee you that your loved ones are going to continue to get the care that they've expected. One thing, you know, they might not get a bath as often as they did before, but they're still going to get adequate, appropriate care, and we're going to try to keep it at the same quality level that we always have. And at this point, I'm not necessarily seeing that as being a risk, but just in case, I want you to be aware of that. Infection control and hand hygiene policies have to be in place and have to be educated on and so forth, which we've been doing ever since this. Oh, well, we did it before this started, but when this started, we've been really pushing that. So that's all. Those are all checked off. So the only other two that really are ever going to be a problem here at Fairview Haven would be, number one, no new facility acquired cases in 14 days. So you have to spend 14 days in a phase before you can move on to the next one. And in that 14 days, you can have no new facility acquired cases. So what that means is anybody that lives here cannot test positive unless they've come from the hospital or they've come from another facility or from their own home. If they haven't been here for 14 days, then that's not considered a facility acquired case. However, I will just say this, that if we have anybody test positive, we're probably going to just kind of pull in the reins a little bit until we get on top of things. But we will not be able to move forward, and we will have to go backwards if we have a resident that tests positive. And then the last thing, which is important for all of you to understand and know, and for us as well, when our staff is out and about in the community, is community spread, community prevalence, and the metrics for our region. There's certain thresholds that we have to be meeting in order for our nursing home to open up and to move to that next phase. So for example, the positivity rate is something that is often published on the news and talked about. I believe the threshold rate is 8%. Our region right now is at 7%. So we're very close to that threshold mark. Now, thankfully, I shouldn't say thankfully. Well, I mean, we are thankful that Livingston County at this point, I think, is at like 2%, but I'm not 100% sure on that. So if somebody has a different number on that, don't say that I'm a liar, because I'm not meaning to lie. But it's pretty low, but it is on the rise. I shared statistics with the staff this morning. In June, in Livingston County, there were 15 cases reported. That's like one every other day. In July, there were 33 cases. That's one case per day. August were 108 cases, which is 3.5 cases per day. And in September, this was as of yesterday, we had 31 new cases, which is 10 cases per day. So please don't think that COVID is gone. Please don't think that it's not a threat yet in our community, because it's actually more of a threat today than it ever has been. You could argue and say, well, the hospital rates are not going up, and that's true. They're not at this point. You could argue that the death rate is not bad. In fact, I don't know that there's been any deaths in Livingston County in August or September. I'm not 100% sure on that, but it hasn't been real bad. But understand that part of the reason for that is because all of these positives are younger people. That's where the positives are coming right now. People going back to college, people going back to school, people going out and partying and not wearing masks and not social distancing and things of that nature. That's what's happening. That's why the numbers are going up if you look at many statistics. So please understand that the reason you're not seeing the hospitalizations is because those that are high risk are still protecting themselves. Those in the nursing home are still very well protected. So that's why the numbers don't seem to be as bad as far as mortality and hospitalizations and so forth. But we don't want to let our guard down. We want to continue to be diligent in protecting people. I just really want to put out a plea that in our community, if you're not going to do it for yourself, do it for the residents of Fairview Haven, because they're stuck. They're in quarantine until we can get on top of it. And if our metrics go backwards and we meet those thresholds, then our residents are not going to get to move to phase 3. Our residents are not going to get to go out. You're not going to get to come inside to see them. And none of us want to be there. We want to advocate for our residents, and we want to do everything we can to get to move to phase 3 and stay in phase 3 until I believe the state is thinking until there's a vaccine or a reasonable treatment plan that people aren't at as high of risk. Once we hit phase 3, so phase 3, I should say we've met all the criteria to move to phase 3. As of August 28th, we could have technically moved into phase 3. We have not applied to do that yet. And the reason for that is because we are in an outbreak situation, and I just don't feel like that's the time to move forward. So we have not moved forward yet to phase 3, but we are in the process of planning for that. We are developing the policies for it. We're developing the protocols as to how we're going to monitor indoor visits and how that's going to all operate. We're looking at, so in phase 3, well, the first thing that's going to happen is we're going to open our beauty shop back up. So we know that we opened that up. I don't even remember when it was, but it wasn't too terrible long ago. We said, I think it was the end of July maybe. We said you can come back in. We started servicing them in the beauty shop. Then when this new reopening plan came out, it was very clear that we were not to be operating beauty shops yet. And I want you to know we were not doing that outside of regulation. We actually had documentation from the state that said that we could do that. But once the reopening plan came out, they took that away from us. And so we did close our beauty shop. And so the first thing we want to do under phase 3 is reopen our beauty shop. And that's going to happen as soon as we can move. Indoor visitation is another thing that phase 3 allows us to do. And what that is going to look like is it not going to be that our doors are now open and you can come whenever you want and do whatever you want inside this building. That's not going to happen for a while, but we're going to allow a certain number of visitors for each resident. The guidelines are pretty clear as to what we can and cannot do, and that's kind of what we're still working through and trying to figure all that out. And we'll send out more details as we have them, but for sure, spouses are going to be allowed in, probably POAs, and eventually other family members, close friends. But there's going to be a limit on how many can come in. There's going to be a limit. I don't know if we'll limit the number, the amount of time. We have the right to do that because we do have to monitor, just like the outdoor visits. We do have to monitor any visits that occur within our building. There's some stipulations that we might be able to get around. We're working on that, and we'll again send out more details when we get to that point. As far as going out of the facility, in phase 3, residents are allowed to go out of the facility for purposes other than medical visits, which is what they're allowed to now. We are again studying that, and we will be sending out more details on that. That's probably not going to come as quick as indoor visits. We're going to take this slow, and we're going to do one step at a time, and hopefully, you know, within time we get to a point where we can do everything in phase 3. So that's what we're working on. That's where we're at with the reopening plan. And I'm sure that makes some of your days, and it probably scares some of you. I have to say I have mixed emotions on it. We're, you know, our residents are pretty protected and they're healthy, and we're really thankful for that. But we also understand they need emotional support and they need their families. And so we are excited to move forward, and we will do that as soon as we feel comfortable. We have one more round of testing. Hopefully that can all be negative and we can move forward. But with that, I am ready to answer questions. If you have a question that you haven't sent to us yet, you can type that into the comments section. I have Sally Fair here in the room with us. Brandon is here also to help answer any questions, and Lila just popped in. And just for the record, they all are wearing masks, and the reason I'm not wearing a mask is because I'm talking, but if they talk, I'll put mine on. We do try to follow the procedure as much as possible. So some questions here. Where there is a positive result, is contact tracing being done? And the answer to that is yes. Contact tracing is actually done by the Livingston County Health Department. We do assist with that in the sense that whenever we have an employee that tests positive, the 3 that we've had, we have reached out to them and we've asked them, you know, were you in we basically are contact tracing for here at work. The one thing that you need to know is that if an employee tests positive, we don't consider them unless they tell us that, there's a wire down out there, unless they tell us that they were in close contact here at work with another employee, like maybe they were on break and they took off their mask while they were at break or something like that, and they were only sitting a couple feet apart. That would be considered close contact. But when they're here working, they are instructed, and it's enforced that they are to wear their mask at all times when they're around other people. So we believe that and the reason the health department, at least this is our understanding, that they don't take into consideration mask wearing when it comes to quarantining people that were in close contact is because they don't believe, they're not sure that every mask is effective, that it is made of the right material. We are wearing medical grade masks, so they are safe. We also require them to wear them over their mouth and their noses, and we monitor that and we enforce that. So we believe that anybody that would come into contact here at Fairview Haven is probably not going to be considered a close contact. We do study that, but just understand that they're not quarantined from work if they were in close contact here at work.
We also pay attention to what hallways they work to monitor those residents.
Right. So if somebody worked Angel Avenue, for example, then we would monitor those residents closely in the days after being exposed. But again, there's not a whole lot of risk because of the mask wearing and because of the universal precautions that we're taking. But we are monitoring residents and making sure that if there are any symptoms that we're right on it. An exciting thing that we hadn't talked about yet is we received a POC, point of care testing kit from CMS, the federal agency overseeing nursing homes. I believe now every nursing home in the U.S. has received one of these kits, and it is a rapid test, a rapid antigen test that is approved by FDA. It takes about 15 minutes to read, so we swab the person and in about 15 minutes we have a result. That's a really exciting feature because now whenever anybody displays symptoms, we don't have to question, should we test them? Is this allergies? Is it a sinus infection? Is it, whatever? Now we just test them and see what it is. If it is, it's not 100% conclusive. So if somebody tests positive, I believe they would be tested again with a regular, called a PCR test, which takes 24 to 48 hours to get the results. But at least we can isolate that person until we get those results back if we get the positive on the other one. And if we get a negative, I think, depending on whether we're in an outbreak or not, then we can take that negative or we don't take that negative. There's a lot of different variables to it, and Brandon has studied it. But if you have questions, you can ask him about that. Anybody else want to say anything about contact tracing? Okay, another question. Has any thought been given to inside visits by appointment in a special room where there is plexiglass separating the visitor and resident? This process has been set up in several of the facilities around us. I am most familiar with what Westminster is doing. I have heard about this, and we have looked into this just a little bit, not anything real in depth. It's definitely come up several times. I guess that we haven't really thought about it or considered it because we feel like we're really close to having indoor visits, and so we probably will move forward in that. As far as the plexiglass, I think when I looked into it, that doesn't really give you enough barrier unless it's like floor to ceiling and wall to wall or something like that. So I mean, it has to be a pretty separated room. And again, if somebody has more details and it's easy and it's something we can do, then we can consider it. But at this point, we're very close to allowing some indoor visits, so we're not really digging into that. I know the hairstylists were allowed back in, however, they are not in the premises again. What plan is there to take care of the residents' needs? This is one thing that at least makes the residents feel good about themselves, even though isolated. So again, I already addressed that. We were told by the state that it wasn't actually acceptable for them to come into the building, and so we have asked them not to come currently. I believe that started about August 14th. And we're hopeful that within a week or so, if everything continues to move forward the way it is right now, that we would be able to allow them back in. In the meantime, we have activity staff that does do hair. Brandon and Lila have actually done haircuts of some of our men here. So we're going to do our best to take care of them, but yeah, that's where we stand on the beauty shop. So what other questions do we have?
So we have a couple questions. They're all three about testing. Did you answer the flu shot one? Okay. Sally's answering some of them in the comments, and then some of them I'm getting sticky notes for. At what point would you qualify for rapid testing? Okay, so Jay talked about this a little bit. We do have our rapid test machine. It's pretty cool. I've done a couple of them so far today.
You want to take your mask off?
Yeah, please. We've done a couple rapid tests today. It takes 15 minutes. It's like it looks like a big fat pregnancy test. Honestly, you do the swab. It goes in the liquid. You swirl the liquid, put drops onto. It's like a plastic tray with like a paper inside that kind of like soaks up through the paper, lines appear on it, but then there's actually a digital reader that reads the test rather than trying to interpret the different lines and what they mean. You just stick it in a slot, and it takes 3 seconds after it's sat for 15 minutes. And the test sits for 15 minutes, then you insert it into the reader, and that takes 4 seconds to read it. So far, obviously, they've all been negative. The downside is that it is not as accurate as the PCR tests that take about 2 days to come back. And there's, like Dave said, there's a variety of criteria that change whether or not you accept the positive or you accept the negative or you reconfirm it. It's very dependent on, are you in an outbreak? Is there known exposure? Are there symptoms? Are there no symptoms? That kind of thing. So there's like a flow chart that you follow, kind of like a if yes, then this, if no, then this type of thing, and then you just keep going through the options until you get to the final conclusion of what you got to do with that result. Most of the time we're going to have to reconfirm it with a PCR anyways, but it does give us a good idea of what we're looking at. And then also we're hoping to use it for staff that maybe they show up and, you know, we're going to harvest, maybe they have a sore throat, runny nose from allergies. This happens every year. Maybe they get a headache, but we can quickly find out, or at least have a really good idea of whether or not they're safe to work or not. So technically we are, since the government gave us this test, we are qualified to use it. They gave us 240 kits to test with. Unfortunately, that's not enough for even one round of testing of staff and residents. We're trying to get more tests, and once we secure a steady supply of that, we can look at using it more widespread, but right now we're just using it on symptomatic people, or just to rule out, or, you know, confirm that people are not positive. Let's see, if testing needs to increase in frequency, when will this occur? So right now we're testing as frequently as I think we'll ever have to, hopefully. It's on a weekly basis. We were just doing staff until we had an official outbreak, which, just saying, our outbreak, neither of our 2 positive cases were linked at all, but because they both occurred within 28 days, that's why we're in an outbreak. But it was 2 completely separate scenarios, not even linked. So that's why we're now doing the residents as well. I'm so thankful that they all came back positive from this week.
Negative.
Sorry, correct.
That's pretty.
They all came back negative. That's a pretty major slip
It's a
up.
positive thing, so I always say positive too. I get them
Yeah,
mixed up
yeah.
because it's a positive thing when they come back negative.
Yeah, okay, that's a pretty big deal. All right. Thankfully, they all came back negative. So if next week everybody's negative again, we can drop back down to whatever is dictated by our county's positivity rate, which we were at a monthly frequency. So this is new. It kind of happened while we were in the middle of doing our outbreak testing, but going forward, there is now a regulation that we have to test on a regular basis, but based on our county's metrics, it was monthly, but if it continues to climb, it might be weekly anyways, and we'll keep doing this for who knows how long. But hopefully we can stay at that monthly level, because it is a huge time-consuming effort to test everyone. Lots of manpower and staff time needed for that, and it's just it really eats into your production.
Which I might add on that, we did have volunteers come in this past round of testing. We had some nurses and people to help with the paperwork, and that was extremely helpful. So if any of you are on, thank you for doing that. And if anybody out there is interested in doing something like that, we do have to have a nurse or an EMT observing the test, the swabbing, and then just anybody can do the paperwork. So if that's something you're interested, reach out to Trish Steininger, and she would be happy to put you on the list for future times if we need that. But hopefully it's a monthly basis and not a weekly basis.
Can you clarify that's like staff testing, not resident?
Right, that will only be staff testing. We will not have to test residents again unless there is a positive resident or if there's 2 positive employees in 28 days.
And so the employee testing is what's so time consuming, because we have to be available for testing for so long, because it needs to be convenient we have so many people that don't work all at the same time. So right now we're doing Thursdays from 2 to 6 and Fridays from 6 to 3. So it's a lot of time waiting on them to be available to come to us to get tested. 4 of us worked on the resident testing this week on Tuesday, and what would you say, it took like 2.5 hours?
About 3.5.
3.5 hours. We went room to room, switching our PPE between each room, and obviously doing good hand hygiene and everything. But we could go to them because they're here, so it didn't take nearly as long. But it is very time consuming. And then the last question here is, can you clarify about current testing and future testing for residents and staff? I think I probably covered that one while I was answering one of the other two. But again, there's a good chance we'll have to do, or we have to do this on a regular basis, hopefully monthly. But it depends. If the county keeps ramping up, then we will have to keep doing it more often. Is the PCR testing super sensitive? So if you have a cold, which is coronavirus, will it come up positive? You will not test positive on the PCR, let alone the rapid antigen, if it's not a COVID-19 coronavirus. So we've had coronaviruses of one sort or another forever, basically. I mean, I don't know, long time. I mean, years and years and years. There's been coronaviruses causing colds and such like. These tests are specifically COVID-19. You will not test positive if you just have a random coronavirus that has been around in circulation. Is it super sensitive? The PCR is, I believe, the most accurate available. It's not perfect. No lab test is perfect. I would say we're honestly pretty fortunate that they have a test that is as accurate as it is right now, with as little time as they've had to develop it. Even tests that have been around for dozens of years are not much more accurate than these. So.
And honestly, the rapid tests aren't that much less accurate than the PCRs. So
Correct.
they aren't quite as accurate, but it's not like they're only 70%. I think
Right.
they're even in the high 80s and 90%,
Right.
so it's not.
Even the rapid tests are very accurate.
Mhm.
It's just there's enough chance for error that they just have to confirm it with the PCR. But it's not like a total guess in the dark, by any means. Any other questions, Sally?
You might die anyway, so. There we go.
I hope you need.
I might just add on that last question too. We often hear, anytime that I tell somebody that we have a positive employee, somebody tested positive, almost always the first question is, how do you know it's not a false positive? And I would just say to that, I don't know. We don't know. There's no way of really knowing that if the person's asymptomatic. But I guess, we work in the nursing home industry. We take care of older people. We take care of high-risk people. And regardless of whether it's a false positive or not, it's treated as a regular positive. And the chances of it being a false positive are pretty slim. I will say, too, that the 3 people that have tested, I believe at least 2 of them, I guess I shouldn't say that, I don't know for sure, but I know one of them has actually ended up having symptoms later on. So we're pretty certain that all of the 3 were not false positives, but that's not a question we can ask, I guess is what I'm saying. So.
It's not really up to us to determine whether it was false or not, and really the chances of it being a false positive are so low that it's really not a realistic expectation that it would fall. It's not a realistic expectation that a positive test was a false positive.
Right.
Do they test twice? No.
No. Any more
Some
questions
people-
out there?
Some people do go get tested twice, but that's not in our direction or
Right.
at the recommendation of the health department. But it has happened where people go and get tested again and it confirms it. Or if the first one was a rapid, they confirm it with a PCR. So
Right.
that is
Right.
actually sometimes.
If somebody gets a rapid, they have to confirm it with the PCR. We'll give you just a few more seconds. We certainly are open to questions. We know that we don't always do a real good job of communicating, and we want to. We want to give you all the information you need. this last few weeks have been crazy, just trying to stay up on everything with the testing that's going on and so forth. But we do want to communicate. We want to give you opportunity. So if you didn't have an opportunity to ask your questions here, you can always message us here on Facebook, or you can email any of us, and we would be happy to address your questions through email. You can text us. You can call us. We might not be able to give you 100% a ton of time when you call, but we'll do our best. There is an email address out there that we have established specifically for COVID questions and concerns, and that is FBHFamily1, the number 1, FBHFamily, the number 1 at gmail.com. You can always email that, and we will get back to you with that. I think Sally kind of monitors that email, and she'll get the answers that you need. And then also, we're going to try to, on a weekly basis, give you a call through the calling post, those family members that, I think it's the healthcare power of attorney is on the calling post list. And so anytime we have a positive or anything like that, then we will share that with you through the calling post. If you're not getting those calling post messages, please reach out to Sally so she can investigate that. We want to make sure you're getting the messages. It's very important that you know that information. I think there's one more question here. How are the Deer residents doing? What can we do to make things more normal for them? Well, I will just say from my perspective, our residents are amazing, and I can't believe how well they're doing considering the circumstances. They really seem to be in pretty good spirits. I'm not going to say that they're all, just chipper and 100% happy all the time, but who would be in the situation that they're living through? But I'll let Brandon and Lila speak to that. Probably Brandon more. Do you hear anything about?
They clearly miss all of you, and they miss holding their grandkids. I think that's the biggest thing. They just want to hold their grandkids. That's pretty much what I hear the most. They really want to hold their grandkids. They want hugs. They really just want to be able to sit right next to their families. I think they're doing better than, so people my age really haven't ever been through anything worse than COVID-19, whereas our residents have actually been through hard things in their lives, and so I think they're taking it a lot better than people that are younger than them. They have actually been through difficult circumstances, and most of the rest of us on the outside of Fairhaven haven't, so I think they're doing great from that standpoint, better than they could be. I feel like they, it's getting long. They're really tired of it, and I don't blame them. Mm-hmm. But mostly they're holding up. So.
We're asking what we can do for them. They can please send mail, please call, please do virtual visits.
Yeah, FaceTime, patio visits, mail, calls, phone calls. They just
send videos of your kids to me. I'll put them on YouTube.
Yeah, Sally's been uploading videos to YouTube, and then we show that to residents here. That's something you can do if you have kids. They love to watch kids. I was thinking too, I don't know if there's families out there that like to sing or have talent with guitar or something like that. We don't allow big groups to come. At least we try not to allow big groups to come. We're really supposed to encourage and enforce that only one household at a time. But we are allowed to have entertainment outside. So, if you want to come and stand at the fence and sing to the residents, they love that. My family's done that a couple times. It's really a highlight for them. And that includes Serenity Villa too. They have opportunity over there where you can stand far enough away that you can provide entertainment of some sort like that. You do have to be careful bringing your kids for outdoor visits, but you can bring them. I'm not going to just encourage people, if you have loved ones here, obviously, if you're grandparents or whatever, then bring your kids to see them. But, as far as if you don't have a loved one here necessarily, I'm not going to encourage everybody to just running out and setting up outdoor visits, because it can be stressful for our staff. But certainly if you want to organize, an activity or something like that outdoors where you're far away from them and stuff, they love that. And like Sally said, mail, You know, they love getting letters from kids. If you want to have your kids draw pictures or colors or, you know, things like that, they would absolutely love that. We've had people sending in treats and things like that. That's a lovely thing you can do. Just, you know, be creative. Unfortunately, you can't come in, but there is a lot of things you can do to encourage them. And people have been doing it, I will say. So thank you to those that have. I do want to comment too. It was interesting. We found that when we re-implemented the communal dining, unfortunately we had to take that away again. But when we did the communal dining, we did see like the mini mental scores really increase significantly. So just having that really made a difference in their lives. Just to being together and being able to socialize, even if it's at 6 foot social distancing, they still really enjoyed that opportunity. And I think too, the outdoor visits really boosted them, and they were able to go out and be with their family. Again, even though it's still 6 feet away and with masks on, it means something. So if you have a loved one here, an outdoor visit is a great way to show them you love them and that you, to make things more normal for them. It's not going to be normal. It's not going to be normal for a while, but at least we can do the best that we can. So good question. Appreciate that. I think that's all on there right now. If anybody has anything else, we'll wait just a few more seconds. But again, I gave you instructions on how you can ask questions. Please feel free to do that anytime. And again, really, really appreciate your prayers and your support through the past several months. It's been a tough ride for us here, but God's blessed us and He's really watched out for us, and really thankful for the negative test results. Don't stop praying. We got one more week that we got to get all negative, so keep on praying, and if God gives us a positive, then He'll help us through it. But appreciate your support in that.
Did you see your question?
Yep, we got another question. Will the residents be able to ride on the Fairview Haven bicycle once indoor visits start? Will the residents be able to ride on the Fairview Haven bicycle once indoor visits start?
So like, can the families take them? Is that what they're asking?
Yeah, I'm not sure what you're asking there. The bicycle is already active. We've been using it throughout the summer. The staff takes them out on that quite often. If you're asking whether or not you can do it, probably not at this point, because it's pretty sketchy as far as social distancing and stuff, so probably would not allow family to use the bicycle once indoor visits start, although that would be
Yeah, we'll have to.
We'll have to consider that. Thanks for the question. We'll talk about that. Any other questions? If not, feel free to keep posting the questions. We'll watch and we'll answer them as we have time right here on Facebook, or we'll reach out to you individually. Thanks again for joining, and have a wonderful afternoon.